colleagues, this is Dr. Jean Galindez, and right now, it is a very exciting procedure na favorite ko talaga, and I'm gonna show you how to do proper tooth whitening, both in office and take home. And this is Jack, yes, who's going to be my model. So I hope you try to watch the entire video, and this will really help you a lot when you do tooth whitening in your clinic. Again, we're back, and right now, I'm going to the first step in tooth whitening is you have to diagnose your patient. Now, at least 2 weeks prior to the whitening, you should have done already oral prophylaxis. Why? Because when you do oral prophylaxis and then immediately place a tooth whitening material, this will increase the level of sensitivity because the enamel lamellae, once you scale the tooth, is totally open. So the tendency is that when you place a high percent of tooth whitening material, it will go directly and have a sensitivity on the patient. So try to avoid it. So do the oral prophylaxis at least 2 to 4 weeks prior to the actual tooth whitening treatment. And hopefully, also do the diagnosis prior to tooth whitening so that you can see if there are already caries or cavities that you need to address. Now, in tooth whitening, normally, you do the restoration after the tooth whitening, which is done also 2 to 4 weeks later from the last application of the tooth whitening. Why? Because the hydrogen peroxide inhibits bonding. So we do not want your final restoration to not properly bond on the tooth itself. Another thing, it is the shade of the restoration that adjusts to the tooth. It's not the other way around. Kasi minsan, we try to do whitening so that the tooth will go with the shade of the, for example, of the crown, of the bridge that the patient has. It doesn't work that way. So it is the artificial that adjusts to the natural. Okay, so right now we wanted to check if Jet doesn't have any cavity. But before that, allow me to thank the following people and companies who provided the free materials and the facility so that I can teach you how to do proper tooth whitening. First of all, we would like to thank Dr. Malony Santos, who owns the Dental World Manila. So this is the clinic of Dr. Malony. Second is we would like to thank Dental Domain and Optragate. They provided the tooth whitening material because honestly, ever since I've started tooth whitening, I've always used Ultradent products, which is Opalboost. But again, most of the whitening material have almost similar instruction. So if you're not using Opalboost, then you just follow the basic principles that you will learn in this video on how to do it properly. Then the rest, you just follow the instruction of the material that you are using. Okay? So the next is we would like to thank also Alphadent, who provided us the Optragate. The Optragate is necessary to protect the patient from any untoward accident of the material going to the lips. Okay, so thank you for giving us some samples. And of course, another thing is the supplier of Univet, which is the loops that I'll be using. Actually, the loops is not really that important in whitening, but I would like to thank Univet. And then also, I would like to thank the assistant here, Lorna, and of course, our good-looking guy patient who's willing to be my guinea pig for all of you guys. So please watch the entire video. Hi, doctors! Okay, we will be starting now. I've already diagnosed Jack, and thank goodness, wala naman siyang mga cavity. Kasi having a cavity or caries, accretion, abrasion, these can all cause sensitivity to the patient. And of course, we do not want that to happen. We want our patient to enjoy the experience of whitening, di ba? So, the first step, because we're not gonna do any oral prophylaxis, because as I said earlier, you have to have done it 2 to 4 weeks prior to the tooth whitening treatment. So, the first one is to remove just the surface debris. I really use Concepsis Scrub. Now, as I mentioned earlier, these materials are given for us for free. But it doesn't mean that I am telling you this because, I don't use it. I've been using Concepsis Scrub for such a long time. It has a lot of functionality, and this is the best instead of the pumice or the pumice, and the oral prophy paste. The tendency kasi ng mga yon is that it's a little bit abrasive again. So if you use that to clean out the surface dirt on the teeth of your patient, the tendency is that, again, it might cause sensitivity on the patient once we apply the tooth whitening material. So I really prefer the Concepsis Scrub kasi antibacterial din siya. So it cleans the tooth and then make it prepare to absorb well the whitening material. Okay, so before we do the Concepsis Scrub and all these things, and then kasi we wanted the Concepsis Scrub done first so that the surface of the teeth is clean. Okay, and then we will take a shot of the before photo. It's very important that you document the before and after, and this will make your patient appreciate the work you did. So this is why because I really like the Optragate, and this is a good protection for the patient. Okay. We placed the Optragate for the protection, and so we will now proceed with the Concepsis Scrub. So we will brush it. So the first thing is you're going to apply Concepsis Scrub. So first, what I do is, I put a dot, and then when you hold the syringe, make sure that this is the one that pushes it, not like this. Kasi, open a little bit, mag-i-spray kasi minsan wala ka masyadong control. Yan. Yan. So, minsan kasi, dinadamay ko rin minsan yung premolar, lalo na kasi pagka humingiti yung pasyente. And that's, and then you use the handies, low speed, para to scrub the tooth. Okay? Now, pagka meron siyang mga thin material, these are things na whitening, kagat ng parang edge to edge. Jeff. Okay na, edge to edge. just wash it off. Okay, the next step is, check, is you will allow the patient to bite. This is called the isoblock. Now, yan. You tell the patient, sige, okay, so you tell the patient not to keep on moving kasi yung bite niya, just bite and relax. The patient can even, you know, sleep while you're doing it because you don't want his tongue. There's another also, just, you know, this is the isoblock from Optragate, but you can actually use any guard for the tongue so that, again, the material, kasi highly concentrated yung gagamitin natin, and this is only available with the dentist. So after cleaning it, the next step is now mixing this material. And when you mix this material, yan, please don't mix it in front of your patient because accidents may happen, okay? So let's go and mix it now. The Opal Boost, because it's this is 40% hydrogen peroxide, and that is why this is only used by dentists. So it is not available to purchase by your patient. So what you're going to do is you have to mix it. Now the Opal Boost is being mixed because you can actually use it without light activation, or for those who use light here is not necessary. So we need to activate it, and you only activate it when you're ready to use, okay? Because once you activate it, it deteriorates as it progresses in terms of time. Now, whatever is left, let's just say there's something that is left and you're not able to use it, please store it in the refrigerator outside the light of the ref because this is affected by light. So if you have a light directly to it while it is being stored or not used, then the problem there is that the effectivity of the material gets less. So the best way to mix it is make sure you're wearing gloves. Ganun din ang, sandali lang, tatago ko muna yung ano ko kasi baka mag-stain because this one can really cause, pag natalsikan yan, pwedeng mag-stain ang damit ninyo. Ibig sabihin, mamumuti kasi hydrogen peroxide siya. Para bang yung ginagamit nyo panlaba, mas higher concentration. So just make sure na ano. Another thing, as I've said, never mix it in front of your patient. Meron dati na nagkwento sa akin na na-mix niya, tumalsik, lalo na sa malapit sa mata, buti na lang hindi na-apektuhan. Kaya lang natalsikan yung LV bag ng patient niya. So, please don't do that. Now, my tip to you to make it sure is you make sure na this junction is fit. Okay? Make sure i-test mo kung talagang nakasara siya. And then what you do, the first thing is you activate this small plunger. There you go. So, na-activate yung small plunger. And then, once it's activated, you press the red plunger to the white. Never put the white first to the red kasi lumalapot siya. So, ang gagawin nyo is like this. So, you push it like that. Okay? And then, you mix it like this. And then, you mix it back and forth for 25 times until the full material is fully mixed. Ayan. So, I'm doing it in the sink kasi it is the safest place. And this can actually be done by your assistant. Hindi naman kailangan dentista ang gumagawa nito. But, again, if you don't have an assistant or you wanted to make sure na fully mixed siya, then you can do it yourself. Ayan. So, makikita nyo, it is now turning full red. Now, malalaman nyo if the material is not gonna work anymore once it turns white. So, when you dispose of any whitening material, not only for opalescence, it is best that you drain all the excess material or the leftovers in the sink and then wash it with water. Never throw any whitening material in the garbage can or trash can na meron pang naiiwang material because this is also hazardous when it comes to fire. So, pwede siyang magkaroon ng accident sa clinic mo and you don't want that to happen. Also, the only reason that my face mask is outside my mouth is because I am talking. But basically, when you mix this, it is best that you have a protective goggles, you have a face mask. So just in case na nagkamali yung nagmi-mix at nauna yung puti nilipat sa pula, tapos biglang bumigay yung syringe, hindi magiging delikado. Kasi kung matalsikan man siya, the worst can do is yung damit lang niya ang maapektuhan. Pag nalagay kasi ito sa skin, mamumuti yan at saka there is a sting. Okay? So, be very careful. So, I think we have mixed it totally. Once you have totally mixed the Opalboost Boost, what you're going to do is place all the material on the red syringe. Okay? Why? Because you want this protected. Tapos papakuha ko, kunin mo yung tip na nandun. So, ilalagyan siya ng tip. And then, meron din pang sarato kapag kami naiwan kayo. Okay? This is the tip. Okay? It has a parang like a cotton or a brush. This controls the release of the whitening material to the patient's teeth. So, you place a cotton para maproteksyonan yung part ng soft tissue na maaaring kasi minsan kasi lalo na pagka binababad na natin yung material, naglalaway yung pasyente. So, very important sa whitening na may maganda kayong suction machine or salivary ejector to make sure. Okay? So, we're now going to apply Opal Boost. Okay? Para edge to edge ulit. Yan. Huwag mong gagalawin. Ganyang position, Jet, ha? Okay. So, always test first the syringe. Ayan. Okay. Now, ang kagandahan sa library, when you apply the Opal Boost, okay, yung area na hindi mo i-bleach, halimbawa, let's say, etong part na to, is i-cover it ng Opal Boost. Okay? Tapos, uunahin mo yung part na malapit sa ngipin so that masisigurado ka na there's no accident happening. Yan, cure. Yan. So, ang curing time niya is 10 to 20 seconds depending kung ano yung ilaw na ginagamit niya. Tapos mamaya, we will just test kung fully cure siya. Yan. Okay. Yung nilalagay nyo, nandun lang sa gingival junction ng ngipin. Lalo na sa interproximal. Alam nyo, for the longest time, I'm doing whitening. Minsan talaga, you cannot help to have certain accidents. Harap sa akin, konti, check. So, make sure lang na naka-cover yung gum area. Sige, here. Bawal naman. Again, edge to edge. Check. Edge to edge. Yan. Okay. Now, in tooth whitening, kahit halimbawa, let's just say, makover nyo yung certain part ng ngipin, okay, at the end of the day, yung material, mag-i-spread out sa ngipin yan. So, kahit walang direct contact, it is okay. Now, just be very careful sa gums kasi nga, lalo na, okay. Now, yun yung we started with the closest one. So now, we will now spread the entire thing. Okay? Now, yung thickness ng opal gum, ang pinaka testing guide ko sa kanya is that hindi na kailangan siyang yung gums hindi nagre-reflect. Teka. So, take time sa opal gum kasi minsan, pagka nagreklamo yung patient na may masakit, sometimes it's not even the tooth itself. It's actually the gums that has the problem. Check pagka may nararamdaman kang raise lang yung hands ha. Pag may discomfort or teka ha, ko yun. Okay, game. Dun sa gilid ito. Ano, dun. Ayun. Root mo to. Yan. Pagka may mga root exposure, you just cover it kasi magiging highly sensitive yan. Sige, pakicure. Ayan. Scan mo siya. Scan mo. Isa pa, hindi pa set. Change the size of the Optragate kasi dumudulas. Now, be very sure you get the right size of the Optragate at saka ito yung dalawang wings niya nandito sa baba. And then, dahil yung patient, minsan, kasi ang patient normal yun naglalaban siya pagka may ginagalaw ka. So, minsan para hindi mag-dry yung lips niya, katulad niya, nagda-dry yung lips. So, you put Vaseline on it, di ba? Yung ganyan, yan. Tapos you make sure na hindi nga siya dumudulas. Kasi pag nagsislip yung Optragate dun sa kanyang lips, ang ending nun, it means that it is not well fit. Okay? So, mas mabuti na yung because we wanted to protect na during the treatment, walang magiging accident. Now, ang susunod na titingnan nyo ngayon is to make sure kung nakaset lahat ang Opal Dam. Okay? So, make sure that everything is set kasi, again, don't rush dahil nagmamadali kayo that ang ending is baka magkaroon ng accident later on. Ayan. So, pagka you cover yung exposed root dito and then on the end, you cover at least 1/4 or 1/2 of the tooth that you're not going to bleach. So, first you have to test the flow of the opalescence, okay? The thickness is around 0.5 to move your foot forward. Check. Panoorin mo. Yan. Forward. Yan. Okay, the thickness is 0.5 to 1 millimeter or at least hindi na masyado nakikita yung shadow ng ngipin. Okay, and then we will wait for 5 minutes. Then we will agitate. Ayan. 5 minutes. Okay, sensitivity normally happens when you wash off the teeth with water because there's a change of temperature. So it's really ideal that when you remove the material, see, it doesn't feel any sensitivity or pain because we never introduce anything that will cause, sensitivity. Remember, you're applying hydrogen peroxide at high concentration. So, in high concentration, hydrogen peroxide also dehydrates the tooth. So if you apply high volume of water with air, there's a change of temperatures. Second application, the second cycle. So after we suck the previous for 10-20 minutes and agitate every 5 minutes, so now we're applying now a new batch kasi there's a tendency. The reason why we do this is because there's a tendency na nagdi-deteriorate ang hydrogen peroxide. Okay? Now, ubos na siya, so we have to get another syringe. So now we can apply the third cycle, okay, that we will do another 20 minutes because he doesn't feel anything. But in case the patient feels something after your second cycle, then you just stop on the second cycle and then give the patient the take home, because I don't believe in one sitting without take home. That kind of whitening doesn't last in accordance to what the patient expects. Tulad niyan, boost na yung material. Yan. Kasi normally, isang syringe, one application. That's why I always advise what I do to make it economical for you is you do 45 minutes and agitate every 5 minutes. Okay, so now we will wait again 5 minutes to agitate it. Now, on the last suction, you're going now to apply Concepsis Scrub again, but you don't wash it with water. You just apply the Concepsis Scrub to make sure that all the material are removed. So you place it and you scrub it so that when we remove the opal gum, the patient can have a quick wash, but just make sure that when he gargles, he only gargles like a few seconds. And then make sure the water is lukewarm. We're doing this to make sure that there's no edge-to-edge yan. As you can see, I'm not applying any, water. Because I don't want the patient to feel any. And then now, we're going to wipe it out with the gauze. Tapos he can rinse fast. Okay? And then as you can see, once you remove it, if you know na tama yung opal, see how easy to remove it kasi tama yung thickness na in-apply nyo sa opal dump. There you go. So, pagka manipis yung pagkakalagay nyo ng opal dump, ang tendency is it's very hard to remove, and the problem is ano. So now the patient can actually have a quick rinse. This one. Yan na. No. Okay. Okay. So, the application of the Ultra Ease is similar to the application. So, what you're going to do, Jack, is you put it on the top. Okay, sige. Parang tray. Okay. If ikaw lang mag-isa, then put the lower. You will know if it's the upper or lower. Sa lang konto. Yan. Open. You will know it's upper or lower kasi may U and L sign. Yan. Tapos, bite. Then, suck. Para ka nakapaghalika. Yan! Ganon. Yan. Kiss. Yan. Suck. Now, sige, pwede ka mag-swallow. Yan. So, that's how you use it, and then open. And then, if you suck it properly, kasi gagawin mo, okay. Okay, open a little bit. Now, if you're the one who's doing it, imamassage mo siyang ganyan. Just make sure na lapat. Lapat ba siya? Lapat sa tingin mo? Okay. Makikita mo, supposedly, dapat, kung tama ang sucking niya, see, it removes totally the tray, leaving the outer one in place. Then, ganun din sa lower. So, if it's not removing properly, sabihin hindi. Kaya kailangan marunong kang mag-suck. Ayan. So, ayan. So, tapos na. Then, the patient will just have to wait 30 minutes to 1 hour. It depends kung may sensitivity siya. But, Jack, did you feel any sensitivity in the entire procedure?
No.
Okay. So, before I go, okay, here are the very first, the tips that I can teach you on how to do whitening. Okay, the first thing is that, one, as I've said, do the prophylaxis 2 to 4 weeks prior to the tooth whitening treatment. Okay, and then the second one is that if there is any caries, cavity, abrasion, adhesion, you need to address that. If there is a cavity, do a temporary filling first because you want to do the permanent after 2 to 4 weeks on the last day of the last application of the tooth whitening. Once the patient is satisfied with the shade of his teeth, then you can do already the final restoration. As I mentioned earlier, it should be always the artificial that adjusts to the shade of the natural, not the natural adjusting to the shade of the artificial restoration. Then the third is, please try to use Optragate. Now, the challenge only in Optragate is trying to find the right size. And of course, you need to have a good high back because sometimes it's slippery. You know, when the patient, like Jack, is salivating. So that's why earlier you can see, I started using the small, but it seems it doesn't fit him really well because it ended up popping out. So it means the size of your Optragate is wrong. So we have to replace it with a regular one. And then if in case that it keeps on sleeping because of the saliva, then just do, create a support. Now, because when you do this, which is a non-light activating tooth whitening treatment, okay, you don't leave the patient. So you have to check if he's okay. And then the fourth one is you have to follow the instruction of the tooth whitening material. You have to protect the gums, and that is in terms of Opal Extra Boost. You need to place Opal Dam, which is light activated. And then, as you've seen in the procedure, I started first to the gingival area that is nearest to the tooth, because sometimes if you rush placing the Opal Dam, the tendency is sometimes you missed out a little bit of the portion of the gums, and then when you place the Opal Extra Boost, it might seep through, and this can cause gingival irritation. And honestly, hindi siya maganda. Napakahapdi niya. Okay? So, be very careful and make sure you place the Opal Dam at its proper thickness. And as you can see, when I remove it, you know that you properly place the Opal Dam in its proper thickness, because isang pop out lang with the spoon excavator, almost the entire thing got left out. Pagka yan, parang hirap ka, na nagbe-break, ibig sabihin, you try to save the material. And that I do not recommend, because your first priority should be the safety of your patient. Okay? And then, of course, the first treatment of whitening is very crucial, especially katulad ni Jack na virgin pa sa whitening, never had whitening. So, and because he is also a guy now and already at beyond 35 years old, the level of sensitivity of this kind of gender and age becomes higher. So you have to really consider the comfort of your patient. You don't want them to suffer while you're doing the whitening. So you start with 40 minutes. Now, as I mentioned earlier, there's two ways of doing Opal Extra Boost. The one way is the recommendation of Ultradent, which you place the material every 20 minutes and agitate every 5 minutes. Okay, so if you do it in 60 minutes, there will be 3 cycles of 20 minutes and you agitate every 5 minutes. Now, the other one is my style, which is you place it 45 minutes to 60 minutes, depending if the patient is still okay after 45 minutes, and you just agitate it every 5 minutes. You don't have to replace the material every 20 minutes. Now, what is the pros and cons of both of the procedure? The pros and cons, the pro for the 20 minutes every cycle that you change it is that you can really literally have a one-time appointment with the patient. Okay, so one sitting. Now, with the 45 minutes, the patient has to come back 24 hours later so that you can apply the second application, which is another 45 minutes. Okay? Now, the con of the 20 minutes cycle for 3 times is that you will need almost 3 syringes of the Opal Boost, because 1 syringe for canine to canine, upper and lower, is just enough for 1 syringe. Okay, so it means if you're going to do 3 cycles of 20 minutes, you will need 3 syringes. And again, it really depends on how you charge your whitening. Your cost may become higher. So the tendency, alam ko naman, mga dentista, they don't, they try to save as much, to lower down their price as well for the patient. And that is where the 45-minute application, every 5-minute agitation comes in. Because then, you only need to really use actually almost 1 syringe. Because sometimes if it's canine to canine, half of the syringe you can use for 1 application and then the other half for the following day. Yan, medyo tipid nga lang yung gamit niya. And that is why, in both cases, because I never believe in one time, one sitting whitening. Also, with the application of light, with the exception that if your material needs to be activated with light. But otherwise, I don't like using light because this causes more dehydration for the patient, resulting to higher level of chances of sensitivity. It only masks the change because the tooth is too dehydrated, so it really looks white. So for me, if the light is being used with the material that doesn't require light for activation, then it means it is just being used for marketing point of view. That is my opinion. Okay, so for me, I rather do a whitening that doesn't require light because this lessens the chances of sensitivity on the patient. Okay, you can actually charge high even without the light as long as you do it properly. Then the next thing is that never apply water and pressure on the teeth while you are trying to remove the material on the tooth, because remember, the tooth during tooth whitening is highly dehydrated, and if it's dehydrated, the enamel lamellae are so open to the point that if there is a change of temperature, then of course there will be a sensitivity and the feeling will go through right into the pulp and go to the brain, and you don't want your patient to suffer like that. If you want to try it, do it to yourself. You can actually know how it feels. Yan yun. So please don't do that to your patient. So on your last treatment, I always use, as I've said, also to prevent sensitivity, I use Concepsis Scrub before and after. And very light pressure because this allows the total removal of any bacteria as well as the material on the last end when you're trying to remove already the material. And then, if your patient needs to gargle now to remove all the saliva kasi nagsasalivate ang patient, then make sure that the water is lukewarm so that the change is not that drastic in terms of temperature. And it will not like change, you know, suddenly there's a feeling of sensitivity because there's a change in the environment of the tooth that is highly dehydrated. And then immediately take the shades and then use the Ultra Ease. I highly recommend the Ultra Ease, which is a potassium nitrate, and what it does is that it kind of moisturize the tooth. Kasi it's like the skin. When your skin is highly dehydrated, you place something that is soothing, which is a moisturizer. So the Ultra Ease, which I've used, is a moisturizer. Now, for you dentist, when you are doing an in-office and then a take-home, if your in-office doesn't require an individual tray, then the take-home must also not require an individual tray. So for him, okay, I will prescribe him the Opal Go. Yeah, here. Because the Opal Go doesn't also require an individual tray. So para hindi na pasyente mo gagastos pa ng individual tray. And then, the style of applying the Ultra Ease is the same with the Opal Go. And what is good about the Opal Go is that it is really quick. Like for example, in the morning after the patient brushes his teeth, all he can do is apply it and then allow it to wear for 1 hour, 30 minutes to 1 hour, depending on the percentage of the Opal Go. And then he can take a bath, you know, prepare his children, whatever. And then after that, remove it again and then brush their teeth. And then basically, if the patient doesn't have any bad habits, of course, it is easy and they can use a whitening toothpaste that you can prescribe. Okay, and for this, you prescribe the Opalescence whitening toothpaste. But whatever whitening toothpaste you do have in your clinic and you're selling it to your patient, you can also use that and prescribe it to the patient. But that is going to be the maintenance of your patient while he is applying the take-home as well as the... And then after the take-home, which he will apply 1 hour once a day for 7 to 10 days, and then he will come back. And then you will just have to ask him how it feels and blah blah blah, and you can get another shade. Okay, now remember the shade that you will see now and the shade you're going to see after he comes back to you, after he finishes the take home, is not the end shade. Okay, that's not the final shade. Yan yung dahilan kung bakit ang mga pasyente sinasabi nila bumabalik yung kulay ng ngipin nila. Hindi bumabalik yung kulay ng ngipin nila. Ibig sabihin, yung kulay na nakikita nila after 10 to 14 days is actually the actual shade that has changed after the whitening treatment. And for the correction of everybody, it is not the color that you are changing when you are doing whitening. That is actually the misconception of a lot of dentists and patients. What you are changing in whitening is the value of the color of the tooth. So, let's just say, for example, Jack has C1, okay, and then it changed into A1, okay? So, mapapansin nyo ang change ang change ng prosto na shade guide versus whitening is arranged according to value. So, yung mga 9 shades lighter, 12 shades lighter, don't believe it in. It's just really marketing. The actual, according to the ADA, if we are basing on color, it will only change 2 to 3 shades lighter. And so, yung binibilang nila, because it is arranged, halimbawa, originally A3 siya, and then you go here, so akala mo ang daming change niya, but actually, it wasn't that one. Like, for example, if it's A3, 1, 2, 3, 4, 5, 6, 7 shades lighter. Kasi yung A1, nasa bandang una. So, but that's, if you arrange it in prosthodontic shade guide, that is only 1 shade lighter. Because that is A1, A2, A3. So, that's 1 shade lighter. So, again, remember, what you are changing is the value of the color of the patient. So, if the tooth is yellow, then it means it becomes lighter yellow. Okay? So, ngayon, how white is white, it really depends on the sclera. One general rule, look at the sclera of the eye of the patient unless the patient has sore eyes or hepatitis. So, but kung healthy siya, you can base the how white is white through the sclera of the eye. And that is the maximum whiteness that the patient can achieve the whiteness or, the whitening treatment. So also, if the patient wants it whiter, you can do so. Only I advise that once the incisal edge of the tooth of the patient becomes translucent, then that's it. Stop whitening the patient. You know why? Because dadating yan, magiging para na siyang transparent, and then it becomes dark because now it reflects the inner surface of the tooth. So I hope you enjoy my lecture or the short tips for you in tooth whitening. And again, thank you so much for all the people who has supported me in order to do this instructional video. So again, thank you to Dental World Manila for Dr. Malony Santos, who owns it. Thank you to Dental Domain, Ultradent. Thank you to Univet. And then, thank you also to Alphadent, who provided us the Optragate. And also for my beautiful patient here. Yeah. Kasi nagiging bading na siya paganda na ng paganda. Okay, so, this handsome guy who hopefully will have a better alignment soon kasi his final restoration is veneer. Now, kung tinanong nyo, bakit pa siya nag-whitening? Kasi ang kagandahan nun, ang Edelweiss veneer doesn't require a lot of tooth reduction. So, since there's almost no or very limited tooth reduction, of course, we wanted a whiter inner part of the actual tooth. So, ang mangyayari, Dr. Stefan hopefully will use an enamel shade that will only reflect what is the actual tooth at the back of the Edelweiss. So, dahil nag-widen siya, yung magre-reflect ngayon maputi. And I also thank you to Lorna who's assisting me. Yay! Thank you so much. Yes, and yes, so maraming salamat for watching, and I hope you have learned a lot about doing whitening right. Thank you.